Welcome to a new episode of Medicine in 3 minutes. We go straight to the point. The subject is bravely made clear and often illustrated. Today's topic is about stage of labor and cardinal movement of labor. We will deal successively with uterine change during pregnancy for the corpus, isthmus, and cervix, the cervical softening, effacement, engagement, descent and flexion, internal rotation, extension, external rotation, and expulsion. Uterine change. Uterine smooth muscle growth occur by hypertrophy and hyperplasia. Hypertrophy cells 20 to 30 times size. This is a muscle cell for no pregnant, and this is muscle cell for pregnant, 30 times. Uterus, it comes from 60 grams to 1,000 grams, 15 times. The upper segment is the contractor uterine, which thickens. The lower segment is thin. For most of the pregnancy, the uterus and cervix have a containment function. Most of the uterus is smooth muscle. Most of cervix is collagen, not smooth muscle. Isthmus is 75% collagen and cervix is 90% collagen. Initial part of delivery is cervical softening and effacement. Here there is no effacement, internal os and external os. Here is 50% effacement. We see the internal os. And here is the full effacement. Cervical effacement is softening and thickening because breakdown of disulfur collagen that link fiber, and water content increase, and it's go from the consistency of the nose to the consistency of the lips. Here, no effacement, internal os and external os. Here is 50% effacement, full effacement. Before effacement is T-shape, then it moves to Y-shape. Internal os start fanning. Then it moves to V-shape. The cervix has no length anymore. Then it goes to U-shape. The cervix is markedly thin out. T, then U, then V, T, then Y, then V, and then U. Cardinal movement of labor. Initial part of delivery is cervical softening and effacement. Engagement is the descent of the head to the pelvis. As the head comes down, the force of the contraction causes flexion of the head. Engagement, descent, and flexion occur simultaneously. Then there is an immutable order of the sequence. First is internal rotation, second extension, third external rotation, and then expulsion. Immutable sequence. First, internal rotation. The head comes from transverse to anterior posterior. then extension of the head, then external rotation, anterior, posterior, go to the transverse, and then expulsion. Here is the pelvic inlet, and here the narrowest is the anterior posterior diameter, and the widest is the transverse diameter. Mid-pelvis has different dimensions. Narrowest dimension is transverse. The fetus enters labor in transverse and has to undergo internal rotation to pass to mid-pelvis. It starts from transverse to anterior-posterior rotation. Internal rotation. Passing through pelvis, there is a transverse coming to anterior-posterior. Shoulders are every time 90 degrees to the head. Internal rotation from transverse to anterior-posterior. Then extension, movement of fetal chin away from thorax. The purpose is direct fetal head upward to pelvic outlet and out of mother body. Then external rotation, passing through pelvis. Anterior-posterior to transverse. Shoulder every time 90 degrees to the head. Then expulsion, emerging of remainder of fetus from mother body. Purpose, complete birth process. Let's review again. Engagement, descent of fetal head in transverse position to below inlet plane. Purpose, demonstrate adequacy of pelvic inlet. Then descent, downward movement of the fetus to the curve of birth canal. Purpose, transport fetus from uterine cavity out of mother body. Flexion, movement of fetal chin toward thorax. Purpose, allows narrowest fetal head diameter to present to birth canal. Then internal rotation, rotation of fetal head within birth canal from transverse to anterior-posterior. Purpose, allow widest fetal head diameter to present to widest part of the maternal body pelvis. Internal rotation, passing from transverse to anterior-posterior. Extension, movement of fetal chin away from thorax. Purpose, direct fetal head upward to pelvic outlet and out of mother body. External rotation, rotation of fetal head outside mother body from anterior-posterior to transverse. Purpose, allow fetal shoulder to present to the widest diameter of mid-pelvis. External rotation, anterior-posterior to transverse. Expulsion, emerging of remainder of fetus from mother's body. Purpose, complete birth process. Let's review again. Before engagement. Engagement flexion descent. Descent internal rotation. Complete rotation. Complete extension. External rotation. Posterior shoulder. Thank you for watching this episode of Medicine in 3 minutes. Would you like to click the button like, to subscribe? Your comments are very welcome. Thank you.